I'm joined now by Alix Zacharski. She is the Medical Intensive Care Clinical Nurse Manager for the Jackson Health System in Miami. Over the last 2 weeks, that health system has seen an 111% increase in COVID patients. Thank you so much, Alix, for coming in, and I'm sorry it is under these circumstances. What do people need to know? What are you dealing with?
We're dealing with thank you for having me. First of all, we're dealing with a very young population of patients that are coming in extremely sick into the system. They're coming with a lot of symptoms, diverse symptoms, and very rapidly ill, becoming extremely sick, and then really sadly dying pretty quick. So that is what we're dealing with right now.
How young are they?
Unlike the previous wave that we had, or the previous waves that we have had, they're dying in the early mid-20s, 30s, 40s, and 50s. And so we're now having the latest population that we had before.
You have people in their 20s who are dying from COVID in your hospital right now?
Yes, we have had early in their 20s, which is extremely sad. Extremely sad. We didn't anticipate folks dying that young.
Yeah, of course, no one did. Is everyone who is getting critically ill from COVID or even coming to your hospital with COVID and dying, are they all unvaccinated?
Unfortunately, yes. They are all unvaccinated. And that's something that is sad.
Right, because the vaccine is now available to everyone in the United States. What do they say to you, Alix, about why? If they do they tell you why they have chosen not to get vaccinated?
Most of the time when we get them in the ICU, they're already too sick to get vaccinated. And but when they come into the system and they're early on, they say, "Can I get it vaccinated?" And at that point, you can't. If you already have symptoms, you're unable to get them. You cannot get the vaccine yet. We have to get the virus run its course, and then hopefully once it runs its course and if you get well, then after you are better. But once you get that sick, you need to really run the course. Unfortunately, what we're seeing is a range of different symptoms, and it's different for everyone. So what is so strange is that everyone is very different, and of course it takes different game for everybody. So every patient is so different in how the virus presents, and dying so early and so young and so rapidly is what is so unusual for this virus, especially this Delta virus.
I understand that one of your patients who died from COVID recently is a 24-year-old woman who had a child.
Yes. So that's very sad for us.
Of course. Look, the Delta variant is making this so much worse, so much more contagious. You're dealing with it every day. What do you think would help? Obviously, more people getting vaccinated, but I mean, do you want to see everyone wearing masks again inside? What will help?
I think for us, we really want to make everybody aware that vaccination is very important. We want everybody to try to get themselves vaccinated. We do know that for some people, vaccination may not be an option if they truly are allergic to the components of the vaccine, and that could be a factor. But if you can't get vaccinated, do be aware that you need to wear the mask. You need to be exercise social distancing at some level. Stay away from crowds, and do perform hand hygiene. That's something essential. But vaccination, for the most part, at this point, is really a good option, but not the only option that we have. We had no option before. We do have it now. It is very hard to see young population dying when we have an option out there. It's very hard for healthcare workers trying to save lives, especially young lives and any life for that matter, but we have options, and we have done everything. We early on treat now who comes into the hospital, and it's impossible to save lives when you don't help us. And so we really want to make sure that everybody understands that we really need your help to help you.
Yeah. Of course. And we all owe all of you on the front lines all of our help, what we can do to keep more people out of your hospital. Alix Zacharski, thank you to you and your whole team.